going again, and then we'll see if any questions come out of that.
I'm going to put this in the basket before I forget, because I'll leave it on the table. Yeah.
So we're going to move on to anxiety. How is the volume?
Maybe a little louder, just closer.
All right, how's that? Okay, thanks. So anxiety is an even bigger topic because so if you remember, depression had onset in adolescence, really. Anxiety, most people at onset, they can identify their anxiety disorder as starting in childhood. That's not true for all of them, but just developmentally speaking, the first disorders are the developmental disorders, like autism spectrum disorder, some of the intellectual disorders, and ADHD, but then the next set of disorders that develop are the anxiety disorders. So they're the most common emotional behavior disorder in childhood. 10 to 15% of children and adolescents suffer. 8% of teens have an anxiety disorder. Like I said, the symptoms occur as early as 6, or even before that. The key factor is that of teens with anxiety disorders, these aren't just nervous teens, these are kids with functional impairment due to anxiety, only 18% receive treatment. The female to male ratio is equal in younger kids, but becomes more female prevalent or predominant in adolescence. And then again, anxiety disorders have a biologic and a genetic predisposition, so there's a genetic element that makes us more prone to these. And then environmental risk factors. And most prominently, I think that is being raised by an anxious parent. So if you can imagine, parenting practices of anxious people tend to teach that there are many dangers in the world and that anxiety is a scary thing. So anxiety disorders among all age groups are the most common mental illness in the U.S., affecting 18.1% of the population, so that's more than double the number that are affected by depression. They're very treatable disorders, but again, only a third of people who have anxiety disorders actually get treatment for them. Even though they're not getting treatment for their anxiety disorders, they're more likely to go to the doctor or to the hospital for various other things. So people with anxiety disorders tend to monitor symptoms in their bodies and respond to them with anxiety, leading them to go to their doctor's offices. If you talk to any family practitioner, you'll hear about the many anxious people they're treating for various other things. Anxiety versus fear, just definitionally, anxiety is apprehension or worry about a future threat, and fear is a response to an immediate threat. So both involve physiologic arousal, so physiologic symptoms like shaking, or you think of an epinephrine, in the fight or flight response, you think of an epinephrine surge, so the things that you would experience if you're terrified happen in anxiety. Both can be adaptive, so that's really important. If anxiety didn't exist, we wouldn't exist as a species because we ran away from the saber-toothed tigers, when the train's coming, we get off the tracks because we're afraid, we have fear, or we have anxiety. Because anxiety can also increase preparedness. And this is one of my favorite things, the Yerkes-Dodson curve, and it just became one of my favorite things because I learned today that this appeared on the Big Bang Theory.
Oh.
So Sheldon once brought this up because what he was trying to do was to get his friends to make him anxious enough so that he would optimize his performance. Because what this shows us is that if your anxiety is low, your performance is low. As your anxiety increases, your performance improves. So if I had no anxiety about this talk, I would not have prepared. If I was too anxious, though, I would have slipped over this peak performance here, and I would be impaired. So if you think about studying for a test in college, if you didn't care about it, you didn't study. If you cared enough, you studied and you prepared ahead of time. If you waited till the last night, you're panicking and you're not absorbing any information and you're beyond peak performance. So that's how anxiety is good for us. Anxiety is bad when it's a disorder. So those people misinterpret cues that, what's dangerous or in our environment, so they're not adaptively responding to real threats. They are maladaptively responding to perceived threats. So these are the various anxiety disorders, the ones we're going to talk about, are generalized anxiety disorder, social anxiety disorder, and panic disorder, and then we're going to talk a little bit about obsessive-compulsive disorder and post-traumatic stress disorder. All this stuff is just, OCD is now classified with other OCD-related disorders, like that's body dysmorphic disorder, hair pulling disorder, used to be called trichotillomania, hoarding disorder, so that's a group of disorders that's actually separate from the anxiety disorders, but is classically, OCD has been included. And then PTSD, post-traumatic stress disorder, goes with trauma and stressor-related disorders in the manual. Generalized anxiety disorder is characterized by worry, so it's excessive worry, and it's, they worry about typical things, but they worry more than most people about those typical things to the point that it's impairing. It's associated then with the physiological arousal that we mentioned earlier, so muscle tension, fatigue. When I get anxious, I know it. My first sign is I get stiff muscles in my neck, so that's my warning sign that I'm not dealing with stress. Some people get stomach aches, some people get headaches, but other people, can't concentrate, they can't sleep, they're fatigued. People with generalized anxiety are not easily reassured. It'll be okay. That doesn't work. They may have outbursts related to anxiety, and kids with anxiety disorder, sometimes they have outbursts, so the anger is a cover emotion or it's a surface emotion, but the underlying emotion might be anxiety or depression. And those kids are often misdiagnosed as ADHD because when you're anxious, you're not paying attention well, and if you're chronically anxious, you look like you might, as a kid especially, those oftentimes kids with ADHD are just misdiagnosed to anxious kids. What?
With children, say a 6-year-old, is the anxiety disorder triggered by something, or does it just kind of show up one day, or is it a gradual?
Well, so it could be either. So a child who's been exposed to a traumatic experience might develop an anxiety disorder, so PTSD is not genetically transmitted, probably. But it usually is, you have a kid with, so classically for somebody who's going to have generalized anxiety disorder, they have an inhibited temperament. So their parents can recall that they were fearful in new situations, slow to warm, backed up rather than approaching. So you can look backwards and identify. So it doesn't just show up, but it starts to be recognized, I think, is a better way to look at it. Social anxiety disorder is different than worrying about social situations. It's actually anxiety in a social interaction, so it's a fear of embarrassment or a fear of judgment. So of course it increases in new situations, so meeting new people, or in situations where evaluation is likely, like in class, raising one's hand, doing a presentation. So embarrassment, humiliation, failure, social failure is typical. Fear is excessive and unreasonable. They avoid situations in which they are going to be anxious. So they avoid meeting new people, going to parties. They might avoid raising their hand in class, even when they know the answer. They might avoid giving presentations. They might be sick or miss work or school on the day that they are scheduled to do those things, or else they'll endure those events with extreme discomfort and distress. So to be a disorder, again, this has to interfere with functioning, so that would be attendance at school, performance at school, attendance at work. So it can be very disabling. You might know people who seldom leave their houses. Those people may have untreated social anxiety disorder, and their lives have been changed because they have chosen pathways that keep them away from new situations and a lot of new people. The thing about this is avoidance is self-reinforcing. So when you're anxious and you avoid something, you feel less anxious, and that makes you avoid more in the future. So treatment early is really important. Treatment at any age is important, but avoiding these avoidance patterns is very helpful. Panic disorder refers to recurrent panic attacks. worry, not just having them, but worrying about having additional panic attacks. So panic attacks are miserable for people who've had them. They think they're dying the first time. They think that they're going crazy. They think they're having a heart attack. So they often rush to the ER early on in their disorder, but they start to then know that they have panic attacks, and they fear less and less those things about the harm to their body or going crazy and stuff. But that panic disorder also leads to changes in behavior. So people who have panic disorder often have places where they're most likely to have those panic attacks. That might be crowded malls. It might be sitting in the middle of a row at a theater where you can't get out. If you're in the middle of the row, it's very hard. If you have a panic attack, you have to go past several people and cause a lot of disruption and call attention to yourself. So they tend to avoid places where they're likely to have panic attacks or where they ever had a panic attack. And then they might do things which are actually kind of smart, like eliminating caffeine or alcohol from their environments, or their diets, sorry. So panic attacks themselves are very common. So 20 to 30% of the adult population have had a panic attack. So it's a sudden rush of intense fear. So it's sort of like a flooding of the system with like the fight or flight response without the trigger of danger. Shortness of breath, sweating, racing heart, dizziness, lightheadedness, feeling sick to the stomach. So those are all kind of well recognized and common. Some people feel depersonalized, so that means they feel like they're outside their body looking down, or just outside their body, or derealized, like the things around them suddenly don't seem real. Usually those don't just occur without some of those other symptoms. People with panic attacks they want to escape. We talked about the fight or flight. That's basically what this is, a miscalibrated fight or flight response. Duration is typically short, minutes. And then an onset can be within seconds, so it's just a rapid escalation and a fairly quick resolution. Obsessive-compulsive disorder is simply the presence of obsessions or compulsions, or both. It doesn't have to be both. The obsessions and or compulsions are time-consuming. They cause distress. They cause impairment in roles. And people tend to keep these secret because obsessions are recurrent, they're intrusive, they're unwanted. They can be images or thoughts or worries or impulses, but people recognize them. The important thing about them is they're not just excessive worries about realistic problems, and people recognize them as such. They're unrealistic and irrational. So people are embarrassed about them because they know they're not true, or if I fear that I'm going to get a terrible disease by touching that podium, I know that's not likely, but I wouldn't share that, especially when it keeps coming back and I don't want to touch the podium. If I touch it, I have to wash my hands 12 times. Or wear gloves to touch it. So people are aware of that, and I used a very common example. We've seen that on TV, and it's really interesting, but there's a lot of varieties of compulsions and obsessions, and they're not always as obvious as the hand washers who get a lot of fame on TV. So they're unwanted, distressing. People try and resist them, get rid of them, and reduce their stress in some way. So the way they reduce their stress, they're distressed by avoiding triggers, by trying to distract themselves by not thinking of the trigger, or doing compulsions. So compulsions relieve the distress caused by obsessions typically. So I threw in hand washing. That's the compulsion that would relieve my distress about being contaminated by some disease that might be living on that podium. So the person feels driven to perform the compulsion over and over again. It reduces anxiety, it prevents something bad from happening. So there are all sorts of OCD that includes, if I don't touch this and then this, something terrible is going to happen to my grandmother. I know that's crazy, but I still do it. I even up. So they're often linked to obsessions, but they don't have to be. And there's often rigid rules about, and sometimes it's just till it feels right. They have to do that behavior until it just feels right. Post-traumatic stress disorder, known as PTSD, is so the main thing, you have to be exposed to something that's outside the realm of normal human experience. So it's not just I was traumatized by the high prices of bread. I was, they fear death, a situation in which their lives are in danger, or sexual violence has occurred or is occurring. Now that can be chronic. We have kids all over our city who are exposed every day to horrible, horrible things. And that just stacks up. So that there's so the chronicity can also be a variant of PTSD, but what we, single trauma PTSD is what we usually think about. So that leads to these symptoms. So that includes re-experiencing symptoms. So that would be flashbacks and nightmares. Kids might reenact those experiences in their play. Intrusive memories are memories that are unwanted at times that, at inconvenient times, but you can't really stop them. The flashback is like it's happening again, like you're there, you're back in Vietnam, and you're transported almost. They also avoid thoughts, feelings, people, triggers, basically things that remind them of the trauma, the place it occurred, somebody who looks like the instrument of the trauma. They might feel detached from reality, and then there are negative changes to thoughts and moods. So they might become depressed, but they might just be kind of tamped down. They might have a lot of excessive fear. They might have guilt about whatever the situation was. They might withdraw from social interactions. And then they're hyper-arousal or arousal. It means they're vigilant, they're watching for the next helicopter, they're watching for the next person who's going to harm them. They have they startle easily if you walk up behind them. And this isn't true for these symptoms are different in every individual depending on them and the nature of the trauma. But and their sleep's disturbed, their concentration is disturbed. And we hear about this because of people who've been exposed to war trauma. They come back and they live with this for years. All right, we're going to take another break and have 5 minutes or so for discussion. Do you think that society views depression and anxiety differently, and why? Does one hold less stigma than the other? And then what did you learn from the presentation at this point that changes your thoughts about anxiety as a mental disorder?